Welcome to the Axial Skeleton lecture. In this lecture, we're going to cover the bones of your axial skeleton, which include the skull, the vertebrae, some of the pelvic region, and the rib cage. So the axial skeleton has a good number of features specifically on the skull that we're going to spend a good amount of time on in the beginning, and then we'll make our way down through the vertebrae, the rib cage, and then down to the sacrum and coccyx. So the skull. The skull is made out of two large bones, the cranium and the facial bones. The cranium is the combination of bones that holds your brain, and the facial bones are all the bones that you see anteriorly on your face. These hold the facial muscles, and they're what hold the eyes in place. The bones of the skull are held together by these joint-like structures called sutures. You will learn more about sutures when we get to the joints lecture. Sutures are immovable joints, and they hold the pieces of your skull together without allowing them to move. So here's our first illustration. Any illustration you see on this PowerPoint is fair game for your lab exam. I have highlighted the sutures in yellow just so you can see exactly where those are, because those are easily missed sometimes. So here's a lateral view of the skull. I like this illustration because it's color-coded and it shows you really almost everything that's on your lab list. Again, that lab list is the list of bones that is fair game for the lab exam. So the large bones is the frontal bone in yellow, parietal bone in green. We've got the occipital bone in brown and the temporal bone in orange. In front of the temporal bone, anterior to it, is the sphenoid bone. We've got the zygomatic bone, the ethmoid bone in orange, the lacrimal bone in green. We've got this large purple bone called the maxilla. It really is the upper part of your mouth, but it does extend all the way up to the nasal region. And in front of that is the nasal bone. So you do have a series of 1, 2, 3, 4, 5, 6 bones here. I would learn them in order if I were you. It might make it easier. Down below is the large bone of the lower jaw called the mandible. This is the only movable bone that's in your skull. This illustration doesn't show you many features, but it does have a few, like the mental foramen. It's an opening that's on the right and left anterior sides of the mandible. You also have this sharp pointed tip of the temporal bone and this really broad tip of the temporal bone. The sharp one is called the styloid process, and the large dense one is called the mastoid process. Exteriorly, you also have this opening for your ear called the external acoustic meatus. On the opposite side of this, internally, is going to be the internal acoustic meatus. I'm noticing now that the lambdoid suture is not highlighted, but just know that this is a suture as well. So what exactly are the sutures? You see these cracked lines? They're technically joints where two bones come together. The coronal suture, this is going to be the squamose suture, and in the back is the lambdoid suture. So let's just look at the mandible. This is a great test image because there's so many features on this. So the whole bone is the mandible. Again, the two openings on the front, right, and left side are called the mental foramen. The ridge that's almost a right angle is called the mandibular angle. This arm up here and this whole thing on the left side is called the ramus of the mandible. And up here on the back, you have what's called the condylar process, and anteriorly this is called the coronoid process. One fact that's good to know is that the condylar process here is part of the joint we call the temporomandibular joint, also known as your TMJ, and that is going to be right here. Internally, in that ramus, you have this opening called the mandibular foramen. So mental foramen and mandibular foramen. The upper part of your mouth is called the maxilla. There's not many features on this that are on your list. The one that there is the infraorbital foramen. and the connection to the zygomatic process. And on this skull on the left, this region that I just circled here is right there. The zygomatic process is this here. Really, it's your cheekbone that you can feel. All right, so now we're kind of moving towards that temporal bone. The temporal bone is going to have a few important features. The first one is going to be the extension of the zygomatic bone, and that's going to be called the zygomatic process. That's this whole thing right here. Again, we have the external acoustic meatus, the mastoid process, and the styloid process. So sharp and short and thick. Now, if I take off the cranium, well, the superior cranium of the skull, and I look inside the skull, I'm going to see a lot of little holes. Those holes are called foramen. Foramen are openings that blood vessels can go through and nerves can go through. So there are a good number of foramen to memorize, but here are just a few that we can start with on this picture. Let's first start with this pink bone. This pink bone is called the sphenoid bone, and it is within here that you have a lot of these openings. So here and on the other side, you've got the optic canal. Optic means eyes, vision. That's where your optic nerves are going to go through. This opening right here, it's kind of a smooth region. It's called the sella turcica. This opening and this opening are called the foramen ovale. Then you have this opening and this opening, and I think we mentioned this a few slides ago, the internal acoustic meatus. The outside of it is going to be the external one. And then this last one here and here, these are called the jugular foramen. It's where your jugulars run through. Jugulars are veins. They go up and down from your brain. And the large opening in the middle, where your spinal cord goes down out of, is called the foramen magnum. So those are some of the openings. You'll see more of them labeled in future images. We're just going to go through this nice and slowly. Easiest way is to study these images and then copy and paste this image alone, to a new slide. And you can print it out or you can label it digitally yourself. And if you do it over and over again, you will find that you're starting to memorize the terms and you're starting to visualize where they're located. All right, this bone here, this little tiny bone, it looks like it's part of the frontal bone, but it's really not part of this bone. It's underneath it. This is called the ethmoid bone. And there are really three main features I want you to know about it. This middle line is called the crista galli. These regions, they're called like flat porous plates, are called the cribiform plate. And there's one more feature of this bone that you don't see on this picture, but you will see it in just a moment. So, the sphenoid bone. The sphenoid bone is this bone that's inlaid into the top of the skull, and you do have a good number of foramen inside of it. If you were in lab, you would see an actual bone, and it looks like this. So this isn't exactly identical to what this looks like, because obviously this is a cartoon, but it's very similar. For your practical, you do have mostly cartoon illustrations of bones, but there will be a few pictures that are of actual bones. So let's go over a few of these. So again, the optic canal and the sella turcica is right here. We've got the foramen ovale and the foramen ovale. Those are the ones that we've been through so far. This one is called the foramen rotundum, which is on your list. And this one is called the foramen spinosum, which is on your list. So let's do it again. Foramen rotundum, foramen ovale, foramen spinosum. This one we haven't covered yet. This is called the foramen lacerum. It's there and right there. These are all features that are part of the sphenoid bone. So this is a great illustration of the sphenoid bone. Again, it has a few other things labeled in it. So in addition to the canals and foramen, there are these structures, which we call the lesser wings. And then there are these large structures, which we call the greater wings, because of course they're much larger. Again, the sella turcica here, the optic canals, and then your foramen, which are listed down there. Now, you were taking a top view of this bone. Let's look at it from the side view. Again, we see the lesser wing and the greater wing. And what we now see are these arms coming down. These are called pterygoid process. The pterygoid process. And this cartoon looks very much like this actual bone image. So again, be sure to learn it on the cartoon and the actual image. All right, here is an inferior view of the skull. There are a few things I'd like to point out here that you won't see on any other illustrations. On the superior portion of the maxilla, you have this region called the hard palate. It is called the palatine process. And back here, you have the palatine bone. So the palatine bone and the extension is called the palatine process. Again, we've got our zygomatic processes. And then in blue is the zygomatic bone. If we go further down, look at the sharp one, styloid process. And the broad one is called the mastoid process. A few things that you need to take note on this particular illustration are the carotid canal. Let's see. What else is specific to this one? Oh, this opening here and this opening here. These are called the stylomastoid foramen. Stylomastoid foramen. Makes sense because it's between the styloid process and the mastoid process, and it's an opening, and therefore we call it a foramen. Stylomastoid foramen. The rest of these you can see on other illustrations, but those ones are important for this illustration. Now we see frontal view of the bone in the facial region predominantly. And what I want you to focus on here is the bones that are in this region. So we have the nasal bone. We have the maxilla extension. You have the lacrimal bone, the ethmoid bone. So nasal, maxilla, lacrimal, and ethmoid. In the opening of the nasal region, you have this blue part that comes up and down. This is called the vomer. The vomer is here. You could also see it on this last illustration that is called the vomer. Everything else we've identified on other images, but be sure to know them on this one as well. So before you start getting overwhelmed, notice that a lot of the images that I've gone over so far have a ton of repetition. Basically, the same features are coming up over and over again, just in different views. So if you want to, take all the illustrations that we went over so far, put them side by side, and start labeling, let's say, ethmoid bone in each of them, so you can see exactly where it is. Now, the next piece we get into are what's called paranasal sinuses. In general, we can just call these sinuses, like when you have a sinus infection or when your sinuses feel full. This is what we're talking about. Sinuses are hollow regions of your skull, and they're hollow in order to lighten up the skull and to amplify sound. You have 4 sinuses that I need you to be able to label on either a frontal image or a side image. The frontal sinus, which is found in the frontal bone, the ethmoid sinus, which is found in the ethmoid bone, and the sphenoid sinus, which is found in the sphenoid bone. Down below is the maxillary sinus, which is found in the maxilla. So kind of easy once you can get the bone names down, because the sinuses are just found in their respective bones. So from the skull moving down to the vertebral column, The vertebral column has 5 major sections. Starting at the top, moving our way down to the bottom, you've got the cervical region. Then you've got the thoracic region, lumbar, sacral, and coccyx. Curvature-wise, the cervical region has a concave curve, and the lumbar region has a concave curve. The thoracic region has a convex curve, and the sacral and coccyx region has a convex curve. So concave means it arches in towards your body. Convex means it arches out away from your body. I do not need you to know how many bones make up each one of these. What I need you to know is the anatomy of each type of bone, which we're going to go into in the next 4 or 5 slides. In general, the vertebral column is made up of vertebrae that are separated by discs. Discs are found in between all of your vertebrae. Now, typical parts of all vertebrae, no matter what section they're in, is going to include the body, the vertebral arch, and vertebral foramen. I have this opening here, which is the foramen, and this curvature here, which is the arch. The transverse processes, which are the ones that stick out to the sides. The spinous process, which sticks out towards the back. And the superior articular process is here. Superior means the top. And the inferior would be on the back end of these guys. So we call those inferior articular processes. Every vertebrae has these features. Same name, similar location. It is your job to be able to name all of these features on each different type of vertebrae. I'm going to go over all the types of vertebrae, and I will point out all 6 of these features for you so that you're able to identify them yourself. Before we get into those vertebrae, the first 2 vertebrae of your vertebral column are very special, and they're called the atlas and the axis. The atlas is the first vertebrae. We call it C1. And the atlas has some major features. Because it is the first vertebrae, it holds the thickest part of your spinal cord, which means this foramen needs to be the largest. So it has a very large vertebral foramen. Its transverse processes definitely point more laterally than any of the other ones. And it has these really smooth superior facets because these are what actually bind with the bottom part of your skull. So the bottom part of your skull sits here and here on C1. Then you have C2. We call this the axis. You have, again, really smooth superior facets, and these superior facets bind to the inferior facets of this one. That means this vertebrae sits on top of this vertebrae. I want you to notice that the spinous process here, really small, and here it starts to get longer. That's going to be true as you get lower and lower and lower and lower. These spinous processes get longer and sharper as you go down the thoracic vertebrae. The other feature here is this tip. If you were to see this in real life, this is a piece of bone that points up. If I were to show you a side view, it kind of looks like this, like a tip, and it points up. This is called the dens, D-E-N-S. Now from here moving down, we're going to start going through the typical cervical vertebrae. Please make sure you're able to identify cervical vertebrae. And I think one of the easiest ways to identify this is through transverse foramen. Cervical vertebrae have transverse foramen. Thoracic and lumbar will not have these openings. Again, we've got the body, the superior facets, the transverse process, which is this whole bone here. It is this whole bone here, and the spinous process. This is a side view, and what I really want you to see is that the body of this vertebrae is kind of small it's not too thick, and the spinous process is not too long. What you're going to see is this body gets larger and larger as we go down, and the spinous process gets longer and sharper, and by sharp I mean the angle gets lower down as you go down towards the thoracic region. So before I start here, look at this spinous process and look at this body. Compare it to this. So this is shorter and smaller, sharper and longer and thicker. So again, body, superior facets, superior whole process. The whole thing is the process. The smooth face is the facet. Transverse process, transverse facet. Spinous process is here. And notice, unlike the transverse foramen of cervical vertebrae, these guys don't have that. In the side view, again, we have the body, it gets thicker. And here you can clearly see the superior facet and inferior facet. They also call this the costal facet for the rib. Here is where your ribs combine to, and here is where your rib combine to, as it says right there. So this feature and this feature are the same, just different views. So here's a fact that you just learned. Your ribs bind onto your vertebrae in two places. The costal facet, which is also the inferior facet here, or the transverse facet. So the rib will come, it'll come around, it'll touch this, and it'll touch that. So this will be the front of your body. Before we move on to this, I want you to, again, write down here. Ribs, I'm going to put lines, you write this. Ribs bind to thoracic vertebrae. So your ribs bind here, here, and here. Ribs do not bind to cervical. Ribs do not bind to lumbar. But now we are on lumbar vertebrae, so let's go through the features again. Body, transverse process, superior process and superior facet, spinous process. Again, body, spinous process, transverse process, superior process, inferior process, and inferior facet. Below that, you're going to have your sacrum and coccyx. There's only a few terms from this that you should be able to identify for the lab practical. Of course, the bone itself, the coccyx, and the whole sacrum. The ridges are called the ala. You have these back ridges, which are like the spinous processes, but we call them median sacral crests. And then the openings for all of your nerves are called the posterior sacral foramina. So circle that, circle that, circle that, and circle that. We already went over this, but we'll go over it again. The curvatures are important. The cervical is going to be concave, the lumbar is concave, thoracic is convex, and the coccyx and sacrum are convex. In terms of ligaments, there are really only two that I want you to know. There are much more than two on this, but there are two that I want you to know. In the front of the vertebrae, so again, here's the vertebrae, this is the body, here's the spinous process. This is what you feel running along your back if you put your fingers along the back. And on the anterior part of the body, you have the ligament that runs all the way down called the anterior longitudinal ligament. Behind the body, running this way, is called the posterior longitudinal ligament. Make sure you know these names for the lab exam. For the lecture exam, I'd like you to know their functions. The anterior longitudinal ligament prevents hyperextension. The posterior longitudinal ligament is what attaches to the discs. So you see these guys here? Those are intervertebral discs. That is where your posterior longitudinal ligament binds. So, like we said, the ribs are part of the axial skeleton, and they bind to your anterior portion, specifically to the sternum, and they go to the back and they bind to your thoracic vertebrae. The ribs have a few different classifications. True ribs are the first 7. These are ribs that individually have their own cartilage binding to the sternum. So we have 1, 2, 3, 4, 5, 6, and 7. Notice after that you have some false ribs. These false ribs are called false because they don't directly connect to the sternum. Notice how their cartilage is converging with true rib number 7. So we've got 8, 9, 10, 11, and 12. As a subclassification of false ribs, ribs 11 and 12 are also called floating ribs because look, they simply float. They don't actually come around to the anterior side binding to any cartilage. I'm going to put a line right here. This is thoracic vertebrae. Here we start with L1, which is lumbar. No ribs there. Then what are these? These are the transverse processes. On the sternum, we have the manubrium, which is this piece here. We've got the body, and then we've got this tip, which is called the xiphoid process. Make sure you know those 3 parts of the sternum. This top ridge here and here is called the clavicular notch, and this top curvature here is called the jugular notch. Everything I just labeled is on your list. So this is just a review again. Manubrium, body, xiphoid process, clavicular notch, and jugular notch. On the sides, you have your sternal angles. The sternal angle is where your manubrium meets the body. And then you have these ridges here. These ridges are where your ribs actually come and bind to using their cartilage. And the last piece, and this is the piece that actually shows you the rib binding to the vertebrae. I want to review again. Ribs bind to 2 places on vertebrae. You have the transverse facet here and in here. And then you have costal facets, which is here and here. These costal facets are called costal because costal or costal refers to ribs. So the rib will come, it'll bind with ligaments to the transverse facet, and it'll come around and it'll bind to the costal facets that's going to be found on the body of the vertebrae.